and Assalamu alaikum. Ultrascan diagnostics here. This is the CVCT of the patient that you had requested. The area of interest is the anterior region. Now we can see on the 3D rendering that there are periapical radiolucencies causing dehiscence of the bone, and quite significant bone loss can be seen. The teeth seems to have a composite restoration on the facial surface. We can also see that there is periodontal involvement in between the central incisors and a periapical radiolucency associated with the central on the left hand side. Now on a panoramic view, we can see we've got 4 endodontically treated teeth. The obturation in the upper left central incisor seems to be most opaque, but the rest seem to be very less opaque. Now we're going to take you to the transaxial view, which is the proximal view. This is the upper right lateral incisor. The root canal seems to be till the apex, but however there are voids present and there is a significant periapical radiolucency associated with the tooth. We've got a 6.4 millimeter by 6.8 millimeter radiolucency. Now this is a considerably large cavity, and a re-endodontic treatment or a periapical surgery will definitely be needed. It's a very well-defined unilocular radiolucency. Moving to the central incisor, on the central incisor we can again see that the root canal does contain voids and there is a significant radiolucency, and this time this radiolucency is approximately 7 millimeters by 7 millimeters. Now this is again a very considerably huge radiolucency, which is also compromising the bone, alveolar bone underneath the tooth. So then we move on to the upper left hand central incisor, and the upper left central incisor is appropriately endodontically treated. No voids can be seen. However, we still see a minor radiolucency, not as big as the ones on the top right hand quadrant, but definitely there is a radiolucency present here, which is also perforating the cortical plate. Now moving to the upper left lateral incisor, this is the one which seems to have no radiolucency. The voids can't be seen, not as radio opaque as the central, but definitely no voids can be seen. So this tooth is doing absolutely wonderful. So if there are any further questions, taking you to the axial view from the top, this is where the veneers or where the composite restorations are, and we're moving down. This is the endodontically treated teeth. We can see the interdental bone, and this is where the radiolucency starts. Now the centrals and the lateral on the top right hand side, the radiolucency is quite significantly big right there. So this is something that the doctor needs to evaluate. A apicectomy or a apical surgery or a re-endodontic treatment with calcium hydroxide is definitely should be considered in this region. If there are any further questions, please feel free to reach to our team. Thank you very much.